Hi, everybody. Thank you so much for checking out this training. It is Wellness Wednesday in the Veteran Roundtable group. Thank you for being here and part of the community. Today, we're going to talk about back pain. Okay, so our Wellness Wednesday for today is all about back pain. And with me, we have Karen Smith, a U.S. Air Force veteran, who is going to share with us a really awesome technique to help with back pain. So Karen, share us, a little bit about who you are and what you do. And I cannot wait for this training today.
Thank you, Dawn. I'm delighted to be here with you as well. And actually, when I was in the Air Force, I had actually started in the accounting department, and super long story, very, very short, ended up in working with computers when they first came in, when personal computers first came out. And we didn't have the manuals back then. We had to teach ourselves. So I do a lot of finger pushing. I love a 10-key calculator and working with numbers and details. So always pushing buttons. And, how long has it been? Over 20 years ago. I had an incident happen where it tore something in my elbow. And went to the doctor. They wanted to do surgery, and of course I refused to do surgery. Nothing had happened, and it just needs to heal. So over a 5-month period of being treated with the common Western ways, what we know to do for a tendon, it just got worse and worse until I finally lost complete use of my left arm and fingers, and the shoulder. If anyone can relate to this, that the muscles just had become so weakened that I couldn't even hold my shoulder up in its socket. So now it's pulling on the neck and the spine. And that is when I met my first reflexologist. Didn't know it at the time. At the office, I would sit down and I'd plug in a heating pad on my shoulder to make the pain go away, and whatever I could do. And here I was coming back to work Monday, and all of a sudden the things that I couldn't do before, pulling on a glove, clapping your hands, any kind of grip, now I was able to do it. And all that had happened was that I met this fella, and he touched some spots on my foot, and he said, "You're fine now." And I insisted, "That's impossible." So he would go a little bit longer. He said, "You're fine, go home." I said, "That just can't be."
Wow.
So when he got rid of me, I drove home. It was 3 hours in the snow back then. It was December 6th, about 23 years ago. And December 6th, drove home, and my husband knew that I couldn't function by myself because I had lost use of my left arm. And so he heard the car door somewhere around midnight or later, and he comes running down the stairs to help me, and I lifted both arms to give him a hug. And that's the look that he had, Dawn. Except his jaw dropped a little bit lower so
Wow.
Imagine that you're calling to someone. Say you're thirsty and you're calling for your husband or one of your children, "Can you bring me a glass of water?" And nothing happens. So you yell a little bit louder, "Could you bring me a glass of water?" Still nothing happens. And you just keep yelling the same thing. "I'm thirsty. I want some water. Would somebody please bring me some water?" And that's what the foot is doing. So by that, what I mean is it's sending the messages, but if nobody is in the room to get the message, or they're listening to another channel at their ear sets, if the message isn't getting through, it doesn't matter how much you yell or the body sends the message, lift your arm. Excuse me, I keep going to my right arm because I had to favor this one. It doesn't matter how much the message is being sent for something to happen. It has to get through to the brain so that the body can function at its optimum. So, reflexology, by definition, is the science of the reflexes that end in the foot. They end in the extremities. So actually, even for those who have perhaps lost a limb, there's still a point where the nerve comes to a stop. And that's the point that we want to get to and relax. so that when you're yelling, everybody's just firing at different speeds. And with reflexology, when we calm that nerve ending in the foot or in the extremity, then everything starts to relax and the messages start getting through the way that it's intended so that your body can work as a well-geared machine. Make sense?
Yes.
Okay, so when we look at the foot, the whole body, every muscle and organ is actually on the foot. So let's look at the foot
I
here.
just want to point out, this is not your foot.
This is not my foot, but
this is a really, really real looking teaching tool.
This is how we learn, and thank you for that. That could have come sooner, right? Let me just stretch myself up here. Yes, so we're wanting to calm down the nerve, and one of the points. Now we're just going to touch on the basics today. We can talk more another time, and perhaps there will be some questions that we can address specifically for people. What the reflex then is doing, the reason that I mentioned the yelling is because when somebody says, "Oh, it really hurts," and dig in here, it really hurts, we don't need to yell. Excuse me, let me back up just a minute. Pain is the body's English. So anywhere that there's pain, it's the body trying to, or whatever our language is, it doesn't speak in vocal cords though. So the only way that it can communicate to us where it needs some attention is through some kind of discomfort, through the pain. So in reflexology, there are over 7,200 nerve endings in each foot. The reflex, again by definition, would be the shortest distance for a nerve to travel. So the message is instantaneous. So until we clear it off of the extremity, then that memory is still attached to the reflex. So no matter what we do at the other end, a massage or our medications or surgeries, as long as the end of the nerve thinks there's a trauma, it's still going to want to muscle memory. It's still going to want to bounce back to the old trauma. So let's take a look at the foot then. And for back pain in particular, we'll get to that. But let's look at the foot just in general. I'm going to turn it around this way because it looks like it's my leg, right? The top or dorsal aspect of the foot is going to be the front of the body, and the underside is going to be the back of our body.
Oh, wow.
So up here at my head, we'll go through this super quick, but the toe represents the head. And going...
Big toe.
Well, they're all fine tuners.
Okay.
But yes, we have one head, so we're going to have it like that. Now, if I had the other foot here, and as a matter of fact, if you'll let me swap out feet here, we'll give a little warning for it this time. I have 2 other feet that these rubber feet were brought in from China and Taiwan, and you can see a little bit there. It may not come into focus.
Oh.
All of the reflexes are labeled quite nicely on here.
Wow.
There's only one boo-boo on it, and I actually had the opportunity years ago to point that out to them before this was changed, and that was very, very exciting, but those are more stories, right? So demonstrating here with the feet, we put our feet together, and because we only have one head, we only want one big toe there, we're going to overlap it. And there you go, Dawn. There is the body. So what comes down from the head? That more narrow part, that bit of a stem on the toe, that would be the narrow part that supports the head. So that's going to be your neck. And then following down, we're going to have the spine the whole way down to where it splits off again. And there you see at the butt of the feet is going to be the buttocks. And it actually is just like the body, where you see fleshy, heavy part, That's going to be a fleshier, heavy part of our body.
Huh.
So the hips are going to be in the ankle. And when we want to work on the muscles of the hip, we would want to relax the muscles around the ankle. If we want to calm the bone, we go after the bony part. So there I would be working the bone of the reflexes back to the bone of the right side of the body. Okay? So let's, yeah, isn't that fun?
This is so fascinating. I'm so excited because I've never known this. I've never realized this is so cool.
And what's extra cool about it, Dawn, is this is a part of everyone's creation. This isn't some Chinese custom. In fact, there's a wonderful story about that. This isn't something that I made up because I got tired of being an accountant. We are created with this. This is already in you. So let's go ahead to the singular here so I can hold a little bit better. Guess it was never my foot over here, was it? So continuing, let's turn sideways then. You have the, excuse me, you have, I have to do it this way. The fatty part, the curve of the toe is going to be the curve of the head. And let me, excuse me, I don't mean to make your camera silly here. Let's make it right though, so that there, the same as my big toe there, I've got the curve of the head, and then you have the stem, so that's going to be the toe. And then going down the foot, you have the beautiful curve, the high arch, hopefully. The arch of the foot, that's going to be representing of the waistline. So we've gone from the tippy top of the head where we have the brain nerves and going down the back, down into the neck, into the cervical spine, into the thoracic spine, into the waistline, and then curving down into the lumbar and the sacral spine and into the hip there. So this is like sitting down, someone sitting down. Wow. So when we look at the foot, now you would ask specifically about back pain. People with back pain often have their whole foot hurting. So that's why we went ahead and addressed that, yes, everything, you're all connected. When there's any place on the foot that hurts, again, pain is just the body's way of communicating. So rather than getting too concerned about, I don't know it, what you know is that where there's pain, the body is wanting attention. So just work that pain out. And I'm squeezing a little bit. If you think of the foot as a bar of soap and maybe work up a lather, does anyone remember those days when we actually used bars of soap instead of the liquid self-foaming soap? And just work up a lather there.
So is there anything like let's say you just wanted to help yourself in some way.
Yes.
Just massaging your whole entire foot is going to have benefits.
Absolutely.
Okay.
Absolutely. Now, when you're working on your own foot, one thing that I like to do is to put on a thin sock. And the reason for that is because we're desensitized to our own touch. So you're not going to pick up, such as if you had a scratch on or an itch on your back, and you ask someone, oh, please itch it. Sure, I can scratch it myself. It's different when you introduce someone else's energy, which is another thing that we'll address it at some point, that this is something that we're able to do for each other. And that's how my husband learned. He's actually quite gifted reflexologist as well, because while I was learning, he would put his foot in my lap, I would put my foot in his lap, and as I worked on him, he would mimic. So mimicking, and that's something that we can do here, and we can share to whatever extent someone would like to know. So just real quick to close up with the spine and reflexology. Ideally, we're not just massaging that's just moving the skin around. We're wanting to get an acupressure, not puncture. That would be a needle. A pressure, though, that moving your finger like an on-off switch, for example. Let me show on my red jacket here.
Okay.
We're going on, off, on, off. So it's a caterpillar walk.
Okay.
Now, you don't have to do that right out of the gate. A rocking motion would be the same. So if I were to pull my foot up into my lap or someone else's foot, I could even take all of my fingernails, if your fingertips, if your fingernails are long, you can even lay them sideways and just rotate in and working that whole area.
Okay, and going down that whole area. Okay.
Or up. All the way around, actually, because the body being three-dimensional, you're going to get different things. I'll just do 2 fingers going up. Look at my foot collapse. I'm very aggressive. Yes, you can even just work up with 2 fingers. The important thing is human touch and the intention to relax those nerves, because if there's pain, the nerve is screaming. We don't need to yell louder. We don't need to yell, I need a glass of water.
I like to say that, you know, pain or any emotion in the body that doesn't feel good is just information, right?
Yes.
It's like approach it with curiosity and kind of lean in to see what it's trying to tell us, because it's there for some reason.
Absolutely.
And I know when we talked earlier, you talked about, you know, if we mask the symptom, so like if our back hurt and we are taking Tylenol or Aleve or something like that, and we're masking the symptom, we're never getting to the core issue, and there's never going to be any healing that's taking place.
And another way to address that would be that, imagine if, you know, you're sending that message out, I need a glass of water, I need a glass of water, I need a glass of water, and someone says, I'm not listening. Well, you're still thirsty. And that's what the medication would do, is tell the body, stop sending the message, I'm not listening. And that's really probably not the most efficient or the best message that we want to send to our body, is don't tell me, I don't want to know. So I like to take the foot as a temperamental child. You know, if someone has achy feet or your back hurts, to take that foot and think of it as a temperamental child. It will be fine. The temperamental child wants to laugh again, wants to play, wants to eat, wants to function normally. The messages just aren't, they're so uptight. The messages just aren't getting through. So each time I take someone's foot, I take it as a temperamental child. Just lovingly hold it, receive it, be willing to hear for, you know, any pain that's going on. And I actually can feel the pain in it. Again, that's not something to stop someone. You know, don't wait until you know how to do it. The person who's attached to this limb, they will tell you it hurts there. Just listen. Just stop and hold it. Just listen. Or if it wants, if it's angry, you know, you can stop and hold it. And when it's ready, then you can start moving again. So when, you know, of course, holistically, we don't think of it as alternative medicine, if you will, rather complementary. That working with this information, and I've had opportunity, been very blessed to be welcome into hospitals or clinical situations to work complementary with your doctors, with the medications they're doing, so that rather than the first thing being that you take a pill or a surgery or start stacking up multiple pills. We've talked about people who are taking 3 or more medications to where you're medicating medication. Rather than that being a first resort and your body sending messages being the last resort, let's make sure that we've cleared off the nerve endings, relax the messenger so that he can just deliver the message. It's received in love. The body knows what to do with it. And then can you imagine taking that body into the doctor? And now when they have to medicate or do surgery or whatever treatments are available, now you've given them the very best specimen, the very best body. The messages are going to get through so that any other treatment will also work more efficiently.
Mm-hmm.
Which is a great segue into what you've shared with me about EFT, because there are other ways to remove that memory.
Yes. So, there's a lot of trauma, big traumatic life events or small kind of like paper cuts over time.
They're big to us though, right? To your 5-year-old, a paper cut is a big deal because that's in his experiences.
Right. I mean like a paper cut being like a little traumatic event.
Yes.
Like over time. But yeah, these can get stuck in the body, right? They can get stuck in the body and then they can manifest as really huge, massive issues.
Right.
Down the road. So EFT is another tool to basically help your body process and release things that are happening. If it was a traumatic event, if there was a post-traumatic stress or something of that sort, if there's a limiting belief that you have that maybe you picked up from, when you were 3 years old or 4 years old.
That's a huge one. I'll exemplify that for you. What did you call that? The belief?
Limiting belief.
Limiting. Thank you. Yeah, that's so important.
Yeah, for sure. I mean, a limiting belief or like a belief that you have that's not helpful to living the life that you want, right? That can stop somebody from putting themselves out there or doing something that they love or quitting their job or finding the right person for decades. Mm-hmm. I mean, it's incredible what something somebody said to us when we were 5 years old, 6 years old can do in the long term. And you may not even be aware that that's there. But EFT can help with discovering what the limiting beliefs could be that are holding you back, but also help you process them, let them go from your body, release them from your body, and then plant new, more helpful beliefs.
Hallelujah.
Really cool. So it can also help with physical pain, which is something that, in our training today, we talked about, using reflexology to help with physical pain and back pain. But EFT is another really helpful way of processing whatever, issues going on and helping your body release that. And then the fourth thing is unhelpful emotions. So I don't like to say, negative emotions or bad emotions, right, because everything, like Karen, like you said, is just information, and we can't have the good without the bad. And we have to, or I should say, you can't have the happy without the sadness. Like sadness is not inherently a bad thing, but it might not be super helpful or super comfortable,
Redirect it.
Yeah. But we do have to acknowledge that emotion and sit with that emotion. And there's going to be times when it's completely appropriate and normal to feel sad, right?
Yeah.
So those are the 4 things that EFT can help with. And I am going to save our tapping demonstration though for another Wellness Wednesday, because I want you guys and ladies to try some reflexology. Yeah. And I love, Karen, I love what you said about, working with another person on it, just to kind of get more familiar with the different ways, with the hand movements, and just to get comfortable with the whole process and just to see kind of what happens, right? Like approaching it with curiosity, if you are, if your spouse or significant other or child is having
children love to help mommy. Mm-hmm.
Yeah, so you can if you have a family or a best friend or somebody that you're living with, you can try play around just like you when you were first learning and kind of see what's happening. And I thought it was fascinating how the foot is built the way that our body's built. That was super, super cool as well. A quick question, kind of a side note, but not really. Because the big toe is related to our head.
Yes.
If somebody has headaches and migraines on a regular basis, would that be something that they can do to kind of help, um, like massage that big toe or?
Yes. With that, and let's get that.
Because I know that's something that my husband struggles with. But I also know that there's a lot of people, veteran and non-veteran, that struggle with headaches,
Right.
migraines, and yeah, so that just popped into my head.
There are now, of course, when I do this to make it even more, to add your essential oils or lotions that you like, um, just in other words, migraines are one that can be multi-layered.
Okay.
There can be more emotional or hormone, or even I had a girl one time that I asked her to drink a glass of water for me before I started. Someone brought her to me with the blanket, the sunglasses, she was completely protected. They were walking her in and just couldn't handle any movement or light whatsoever. So I asked her to drink a glass of water for me, and you could hear it. The water, it was like it was being splashed against a rock wall, a cliff of rocks. She was so dry. So, addressing that.
Yeah.
From the reflexology standpoint, though, absolutely. So a little tough to see here, but along the side of the toes. And we're going to go through all of them. I would just look for anywhere on the toe that there was pain.
Okay.
Because the back of the toe, the fleshy part of the toe here on the little toes, that's going to be sinuses. And what's fun is, so if you know someone who has a cold, any kind of congestion or allergies, that you can press on that and help to move all of that along. Now we're pressing it, so moving that along. And you don't need to be concerned about anything. If someone has big issues that are going on and they say, don't do a massage, we're not touching the muscles. We're not touching the physical area. We're only stimulating the nerve so that the messages of healing can get through efficiently, right?
Okay.
We don't have to be afraid to touch the foot. So it could be a sinus pressure. The hormone areas are going to be down in the side of in the soft fleshy area in the ankle, because all of the male and female organs are going to be down in the hip area. And the third one that I've seen would be if it's somebody's teeth, pressure on the teeth that is mimicking a migraine.
Oh.
So that would be the top of the toes, just below the cuticle.
Okay.
All the teeth in there. So anything on the toe, again, as far as a basic, if I never got to speak to you again, where there's pain, where there's pain, there's pain. The body's sending the message. So if the person or if yourself, if you feel a stingy part, press it so that it hurts good to that level. Let it hurt good. And just know that if you found a spot that's painful, work the pain out. The body's sending you a message, and it's grateful that you're listening.
Oh, that's awesome. Well, Karen, thank you so much for this training today and for the awesome tips, because I know there's so many people that are suffering with pain, physical pain, emotional pain. And a lot of times people who are suffering with physical pain don't see the emotional component to that, but also may not be aware that there's other ways to help them, in conjunction with, medical attention or whatever that they're
Right.
going through. So this is just such a great tip. I can't wait to check this out.
I can't wait to hear.
Yeah, and I can't wait to share this information and let people know that they can go to you for more information if they're,
Absolutely.
do you have a website? I know you're on LinkedIn. So, I'll definitely make sure to tag you and let people know how they can connect with you there. But what's your website?
Iced Tea Talks.
Okay.
Iced with ED, Tea, and talks is plural, but no matter how you misspell it, it should still come to it. We've taken care of that as well.
Okay.
But yes, things that we talk about. So if someone has a question, then that would be something that we'll assume that others want to know, and so that will be one of the blog talks then. Just
Cool.
put little pointers. So
That's awesome. Awesome.
Thank you
so much.
You're awesome.
Everybody, happy Wellness Wednesday. If there's anything that you would like to specifically learn more about, let us know. We are here in the group, and this group is for you to help you with whatever you need and want. So, so have a great day, everybody. Take care, and we'll see you soon.
Thank you, Dawn.